Well, hello, welcome to Veterinary Basics Module 2. This is a two-part module. We'll cover part in the classroom, part here online. This first part is just common physiologic parameters seen in animals, and also basically how to recognize pain in animals. And most of the veterinarians will be familiar with this. It might be a good review, but again, you learned all this in vet school, so it'll be especially helpful for the chiropractors. So we'll go through this, and hopefully you'll find it interesting. So veterinary physiology, pain detection, and we'll do the animal neurological musculoskeletal diseases and common causes of neurologic presentations. We'll do that in the classroom. So physiology. Physiology is the study of function. And we talk about normal rectal temperature in animals. Dogs and cats have a normal rectal temperature of 101.5 degrees. Typically when they come to the clinic, they'll be excited, and this may elevate to 102, 102.5. I don't get too concerned about a possible fever until it gets above 102.5, 103. Then I start thinking we probably have some febrile condition. Horses are also 101.5 for rectal temperature. Chickens, interestingly enough, and I put this in here because I think it's interesting, 105 to 107. Now, because of that, you almost never see bacterial infections in chickens. Viral infections, yes, but hardly ever bacterial infections because the body temperature is so high. Bacteria just don't like to reproduce at that temperature. Pulse, where do you take a pulse? Normally, a femoral pulse is the easiest place to take a pulse on both a horse and a cat and a dog. And just reach back there on the inside aspect in that femoral triangle region, and you can feel that femoral pulse pretty easily. Normal pulse on dogs, the smaller the dog, the higher the pulse, between 70 and 160 beats per minute. Cats around 110 to 240 beats per minute, and horses around 28 to 50 beats per minute. Now, elevated pulse is one indication of pain in animals, so you should know the normal pulse on a dog, cat, and horse, or whatever it is that you're treating, and check these pulses on a regular basis. Respiratory rate in dogs about 10 to 30 breaths per minute. Cats about 24 to 34 breaths per minute. Horses about 8 to 16 breaths per minute. And again, we talk about pulse rates and breathing rates because they can be signs of pain. Respiratory rate will elevate with pain, as will pulse rate. So just something to keep tabs on to help try to determine if the animal's in pain. Owners oftentimes will ask us, is my dog or cat or horse hurting? Are they hurting? Is this painful to them? Are they in pain? And that's one of the indications they oftentimes want to use to recommend or to think about, in some severe cases, putting the animal to sleep if they're in intractable pain. Estrus cycles. Estrus is the heat cycle in animals, and this differs from the menstrual cycle in humans. Estrus cycle is the estrus is the entire ESTROUS is the entire cycle, where ESTRUS is just a period of receptivity. It comes from the Latin word oestrus, which means gadfly, because they thought these animals who were in heat were acting like they were being chased or pestered by flies and running around acting crazy. So that's what it means. Greek, it means to drive mad. And if you've ever seen a cat in heat, you understand where this terminology comes from. This is the period of sexual receptivity in female mammals other than humans. It's a recurrent restricted period, so most of the time, most of the year, the animal is not receptive. The female is not receptive to the male. There is no breeding going on, and at these select times of year, they become receptive to the male, and everything changes, and we'll talk about that. It's also called heat cycle, rut, estration. These are all words for the same thing. Puberty in dogs is around 6 months of age, and dogs are seasonally monestrous. Typically, I say that it depends upon the breed of the dog and the size of the dog. Large dogs oftentimes just come into heat once a year, where small dogs can be a couple times a year. Usually the spring and the fall is classically when they come in. They'll cycle every 6 to 7 months, as I said. The initial phase of estrus in the canine is called proestrus. This is when the vulva swells. They'll have a hemorrhagic discharge. You may or may not see this. Some dogs have a pretty heavy discharge that they'll spot around the house and things when they sit and are actually sometimes leak blood. Other animals have a very light discharge and you hardly ever notice it. Some dogs are very fastidious and keep themselves extremely clean, so you'll never notice the discharge where other animals don't. So it just varies from dog to dog. That proestrus period usually lasts about 7 to 10 days. So when they start, and this is when they're coming into heat. Okay, the actual estrus period, which is when they're receptive to the male, the vulva is very swollen. There is no discharge at this point, so discharge is stopped, and they're receptive to the male. The vulva is very swollen. If you scratch right beside the base of the tail, they'll usually take that tail and cock it to the side. It's called flagging, F-L-A-G-G-I-N-G, and they'll flag that tail. That's to move the tail out of the way so that the male can breed them successfully. They'll also, if you press on the sacrum, they'll stiffen their back legs, and it is to support the weight of the male as he mounts the female. Mid-estrus, this is, if they're not bred, they'll go out of heat. This estrus period, back to estrus period lasts about 7 to 10 days. So you got about 7 to 10 days going into heat, about 7 to 10 days actually in heat when they're receptive to the male. And the female will ovulate at various times throughout this estrus period. She doesn't ovulate all at once. She'll ovulate over a period of several days, and she'll ovulate numerous eggs. And it's possible for one female to be bred by many different males and actually have puppies born to many different fathers. So you can have a female who has a litter of, say, 8 to 10 pups, and she may have, 4 to 6 different dads or males of those puppies, and puppies can sometimes come out looking all kinds of different from each other because of that. The mid-estrus period, they're going out of heat. This is the vulva begins to decrease in size, and they're just slowly going out of heat. And this usually lasts about 50 days. So that's typical for that time period. And some females who have a persistent corpus luteum will develop enlarged breasts during this time, and the owners will think they're pregnant. I've even seen them get milk in the breast, and this is called pseudocyesis or false pregnancy, and the only real solution for this is to spay the female, but so it prevents it from happening in the future. But this lasts about 50 days, and then that starts going away. Anestrus is most of the year when they're not in heat. They're actually not cycling and not in heat during that time. So let's see if we can watch this video. This is a female in heat. She's teasing the male. The male doesn't really want much to do with her. Obviously, she's much more interested than he is about this. He's interested in eating whatever he's eating there, or chewing up the paper. He's telling her to leave him alone, but she's obviously wants to be bred. So you can see her cocking her tail up and putting her back into him. You can see her vulva's very swollen. He's saying, leave me alone. So he's not interested. She is, he's not. That's not uncommon sometimes. Alright, see if we can get this back over here. Close that down. Alright. Forgive me here. We'll get back up here cooking here in a minute. There we go. Alrighty. So back. Puppies when puppies are born in the gestation period, which we'll talk about in a second. The gestation period is about 60 to 65 days in the female dog, and she'll have anywhere between 2 and 12 to 15 puppies, depends upon the breed and the size of the bitch. It just varies. The smaller the dog, the less puppies they have usually. Puppies are born, they have 28 teeth. Adults have 42 teeth. Puppies have deciduous teeth, baby teeth, just like we do. And they'll begin to lose those teeth. And by 6 months of age, they're replaced by the adult teeth. The last teeth that come in are typically the canine teeth. And they'll lose those canines right about 6 months of age. So it just helps you kind of determine how old the puppies are. Puppies open their eyes between 2 to 3 weeks of age. They are born with closed eyes. and those will open around 2 to 3 weeks of age. Estrus in cats, the queen, she hits puberty around 6 months of age, just like the dog do. Dogs puberty around 6 months of age. Female cat has 2 to 4 estrus periods per year, and they last 15 to 21, 22 days. If she's bred, estrus won't last more than about 4 days. But she'll keep cycling typically throughout the year until she is. Now, it requires about 12 hours or more of daylight to maintain normal cyclicity in these cats, So you won't start seeing them cycle till springtime and after that. And they'll cycle every 21 days until, once they go into heat. Cats are called induced ovulators, which means they got to be bred to ovulate. And so if they're not bred, they won't ovulate, and they'll just keep cycling. It's possible, if in the right time zones where they have more than 12 hours of light a day, for an unmated female to cycle every 3 to 4 weeks indefinitely. And I'm going to show you a video here of a cat in heat, and you can see how they act. And you can see why they call them drive them mad, because they act like they're crazy sometimes. Owners will present these cats sometimes, think something's wrong with them. They'll think they're seizuring. And you can see how this cat is acting. Hopefully you can hear this. Hopefully this sound is coming where you can hear, but he's just describing this cat in heat. And that's a cat in heat. All right, continue on. Cats don't have the alveolus vaginal discharge or swelling of the vulva that dogs do. Use of behavioral signs are the only signs and symptoms. And you can see how she acted here. She carried her tail to one side. She elevated her hind end. She did the threading type movements. She was very affectionate. She rolled and very restless seeming. They can call, as the video was talking about. They have this very piercing, high-pitched call to call the male. So, again, owners who don't know what this is can be very concerned about this, think something's wrong with their cat. Estrus cycle in the mare. Mares are seasonally polyestrous. They undergo regular estrus cycles during a portion of the year, usually late spring, summer, and early fall, and usually don't go into heat during the winter time. And I think this is nature's way of preventing the arrival of the foal during bad weather. Two phases. They have estrus and diestrus. Cycle length is 21 days. They're in standing heat about 5 days, and horses go through puberty at about 18 months of age. Behavioral signs of estrus: they adopt this urination stance and pass intermittent spurts of urine. They raise their tail. They'll allow the stallion around them, where at other times of the year they will not allow the stallion around them. You can do blood levels. There's increased levels of estrogen and LH, and serum progesterone levels decrease. And as I said, the mare during the diestrus period will not allow the stallion to be around her. So let's see if we can see some signs of estrus in horses here. All right. And here another video. Hopefully this is helpful to you. All right, we won't watch that video. All right, good. Okay. So the same thing, was just showing estrus in the horse. So problems associated with estrus in the horse, obviously behavioral alterations. Sometimes they'll show lamenesses, back pain, abdominal pain. They'll have muscle spasms and this exertional rhabdomyolysis, which is this tying up syndrome, which they'll have muscle spasms and increased myoglobin in the urine, things like this. This can be a problem. So you have to watch this with a horse. This is called the flamen response. Horses have a Jacobson's organ in the roof of their mouth that they can sense the pheromones of the mare in heat, and this is a stallion showing this flamen response. Lots of animals actually do this. Cats do it, rhinoceroses do it, lots of animals do this, so it's not an unusual response, but it's called flamen response. There it is again, the flamen response. Gestation periods, the dog 60 to 65 days, cat about 58 to 63 days. Now this This dog gestation period varies. Some dogs, like English bulldogs, smaller dogs, may be earlier than this. But if they go past 65 days, then something's probably wrong, and you need to start thinking about maybe cesarean sections, things like that. Equine, 330 days. Cow, 280 days. The pig, if you're interested, is 115 days. And obviously dystocia, it means that they're having difficulty having the puppies or the foal or whatever's going on. Most mares will foal very early in the morning. They don't like people to be around when they foal. They like to be by themselves. Dogs will start nesting several days prior to whelping and having the puppies. They will start looking for a place to have these puppies. They'll start going off by themselves. They'll lick themselves a great deal. Their back end, they'll look at their back end a lot. And usually about 24 hours before they have puppies, they'll get milk in their breast. Also, their temperature will drop, usually below 100. So if you're taking the dog's rectal temperature, usually the temperature drops below 100 about 24 hours prior to whelping. Digestive differences, just to kind of just talk about this. Canine GI tract is a relatively short GI tract. They're not a true carnivore like a cat is. They do eat some plant material, but their GI tract is much shorter than the human GI tract, just because the plants are not their primary food. I'm a pretty big proponent of raw diets in dogs. I think raw diets contain all the digestive enzymes and enzymes they need for normal health. It is a little expensive to feed raw diets to large breeds, but the odds or the problems with a lot of veterinarians are concerned about E. coli and salmonella, and while this is definitely a consideration, I don't think it's a real problem with the commercial raw diets we have in this day and time. And also, dogs were eating carrion and dead things long before veterinarians were around and seemed to be able to handle most of these problems without an issue. I also think dogs should be on a grain-free diet. I know most of the research says that proteins are responsible for allergic reactions, and I know veterinarians and veterinary nutritionists who are adamant that grains have nothing to do with allergic disease in dogs. But I can tell you from a clinical perspective, I've seen many dogs who were intractably being treated for allergies that with all sorts of drugs and medication that put them on grain-free diets, and they did much better, and even all the allergies went away. So just for what it's worth. Cats are definitely carnivores. They're carnivorous animals that can eat an all-meat diet. The perfect diet for a cat is about 50 to 54% protein, which is what the protein content of a mouse is. So I think that the food we feed cats, especially kibble, we feed cats, is grossly packed with protein. Most of those cat proteins are 34 to 42% protein, which is, I think, too low for a cat. I think the cat was never designed to eat kibble, which is what the dry cat food is basically a kibble. It's just a biscuit. And if you notice, the inside of the cat bags are always oily. That's because they have to coat those biscuits with oil to trick the cat into eating it. And cats will overeat that kibble food, trying to maintain their protein diet, their protein requirements, and which causes obesity in cats, and it leads to diabetes and things such as that. Equine GI tract, these animals are free. The normal horse is an animal who roams the open prairies, eating grass. Usually for most of the day, 12 to 18 hours a day, the horse is out there eating, roaming, and digesting food that way. I don't think they were ever designed to be kept in a stall. I don't think horses were ever designed to eat oats and mash type foods, things like that. Again, I'm not an equine veterinarian, but I think the horse was designed to eat, grass, and that's what the horse should eat, to be honest. And that's why we see a lot of these other problems like laminitis and founder in these horses is from inappropriate diets. Bovine GI tract, cows were designed to eat grass as well, and I think that they were never designed to eat corn, especially not genetically modified corn. By any means, and I'm concerned about the long-term health effects upon people who eat cattle fed with GMO corn and things such as that. I think grass-fed beef's the way to go. It definitely tastes different. It's not as well marbled, but it's much healthier for you, I think. So just something to think about. Three primary objectives of any animal patient, and that's they have to have safety, they have to feel safe in their environment, they have to have food and water, and they have to have shelter. And as long as all of these are present, the animal will be comfortable and unstressed. But if any one of them is compromised, then the animal will be uncomfortable and stressed. Stress can cause spinal malalignments. Now, do animals get stressed? You bet you they do. For all sorts of reasons. D.D. Palmer, the founder of chiropractic, said there were three causes of disease: toxins, trauma, and thought. And thoughts basically are stress, autosuggestion or stress. So we see these issues in animals, and it causes subluxations. And unless you ameliorate the stress, remove the stress in the animal, you're going to be seeing chronic disease in that animal. And you can adjust them to your blue in the face, and they may get better for a period of time, but they're going to keep coming back with more problems because the underlying cause of the disease process has not been addressed. Nutrition. Again, we talked a little bit about this before. Dogs, I think dogs should be fed a raw diet or partial raw diet. Try to stay with kibble that's grain-free kibble and as least amount of preservatives as possible. The ideal diet for a cat would be ground up mice. I don't know anyone who's done that yet as far as a cat food goes, but I think it might be a marketing heyday if someone could figure out a way to get mice and prepare them and put them in cat diets. Equine diet, again, I think they should be fed hay or grass predominantly, fresh hay, and they need room to run. A horse needs room to run and move around. Bovine diet should be grass as well. Again, these animals weren't designed to eat corn and things like this. Note the hair color of the animal. The hair color and hair consistency is a great indication as to nutrition in the animal. Also the body condition, what's the muscle condition like. Just notice this, feel the animal, see what they feel like. Look at their hair coat. Is the hair coat nice and glistening and shiny, or does it look like an old rug? And that's going to give you a lot of clue as to what's going on with this animal. Just look at that. Also look at the feet, especially on the horse. Look at the feet. Look at the condition of the hoof. On the dog, look at the condition of the nails. On the cat, look at the condition of the nails. It's going to tell you a lot about the nutrition of the animal and the overall health of the animal. Behavior. We're going to go a little bit over behavior now. We'll cover more later on, but we'll do a little bit now, especially with dogs, and then we'll get into some pain discussion. Dogs are pack animals, but there is some new research out, and what the new research tells us is what we thought were packs are actually family units. Most of this research was done in wolves that were reintroduced into Yellowstone. These wolves would form packs initially, but as these packs grew in number, then the family units began to separate out, and what we thought were packs of just unrelated wolves running together now in reality are mother, father, offspring, and siblings and aunts and uncles. So they're basically all related somehow. So these are actually familial units, not just roaming packs out there. They are denning animals, therefore that's why I think crates work great. I like crate training animals. Keep them in crates when they're in the house and not being supervised. This helps a lot with house soiling. Dogs that are unsupervised in homes oftentimes have problems urinating or defecating in the home. And the problem is once they do this, it's very hard to keep them from doing it. Leaking urine can be a problem associated with spondylosis, arthritis, sacropelvic subluxations in animals. For years, we see that spayed female who leaks urine when she sleeps. And of course, we put them on drugs like phenylpropanolamine. It helps tighten that internal urethral sphincter to help keep the urine from leaking. And so it's a treatment, but oftentimes these are subluxations as well. Destructive behavior in dogs is usually due to boredom. They're bored or they're anxious. So two most common causes are boredom and anxiety in the dogs, cause them to be destructive. It's just like these people who buy a border collie and keep them in an apartment all day, and they come home and they wonder why the border collie has dismantled the baseboard or the couch or something like this. And basically these dogs need a job, and if they don't have a job, they'll create a job. So, and that job may be taking apart your furniture. So you need to approach the problem with these animals and be sure and put the right dog in the right situation. Cats are non-social animals. They pretty much hang around by themselves. Occasionally you'll see cats, bind together where you have 2 or 3 cats in a group, but very seldom do you see that. Destructive behavior in cats is usually associated with sharpening their claws and keeping their claws sharp, as well as urinating around the house. Animals, unnecessary soiling outside the litter box. In cats, one of the first things I think about is the particular type of litter that's being used. Cats are very pernickety about litter, and don't be changing litter on cats. Once they get used to litter, they like that litter and like to stay with that litter. But oftentimes urinating outside the litter box can be signs of cystitis or bladder infections. It could also be behavioral issues. It can be other cats hanging out around outside the house, and the cats are urinating around windowsills to mark their territory. So it's a complicated thing that needs a veterinarian involved to really figure this out, and oftentimes a behaviorist. Cats are nocturnal animals, and therefore they're going to want to be out at night, and you have to kind of train them that you sleep at night and you're up during the day. So, but they'll when people first get kittens, they wonder why they're up all night. They're supposed to be up all night. So when you go to these, I want you to go back to these. You can go to these various areas here, like systematic assessment, as I told you, and you can find these different areas with here about pain and animal pain, and find these. This is a great website for this. I want you to use these as much as you can. General responses to pain, again, changes in personality or attitude. This normally quiet or docile animal becomes aggressive, may become quiet. The animal may attempt to bite. The painful area when palpated. He doesn't want to interact with the doctor. Abnormal vocalization, you can see, although this is not common, cats will hiss or growl sometimes. Dogs may whine out in pain, but it just depends on the animal. It really does. May lick and bite the area. They may even self-mutilation, as I said. Oftentimes lick granulomas or canine lick granulomas are a sign of some type of neuropathic pain going on there. The hair coat may change. Look for a ruffled, greasy appearance of the hair coat. This is abnormal, that the animal's not grooming themselves or taking care of themselves. There may also maybe a change in posture or ambulation, limping, carrying a painful appendage up, tensing, things like this. Change the activity level. The animal may become restless. They may pace excessively, or they may just lay down all the time and never get up. Sometimes you see a change in appetite, although, as I said, I've known a lot of people in pain who still eat well, so that's not always a good change. Change the facial expression. Look at the eyes, look at the ears, see what you see in these animals, and just see if they look normal. Sweating or salivation, especially in horses. You can see this. Ocular discharge, especially in rats. They get this porphyrin tearing. It looks like they're bleeding from the eyes and the nose. Teeth grinding in rabbits, cattle, sheep, things like that. Changes in bowel movements, urination patterns. Sometimes they'll just lay in their urine. This is not normal. You need to be familiar with the animal. That's the most important thing. That's why the owner can help you the very most there. They really can. Canine pain behavior, look for these dogs' reaction to pain, and it's going to depend a lot upon their personality. I've seen dogs that, missing limbs who literally almost showed no sign of pain, where other dogs you give a small injection to and they act like you've killed them. So it just really varies between breeds. Look for a hunchback. Look for a praying posture. Praying posture oftentimes can indicate visceral pain, where the front limbs are low and the rear end's high in the air. Think about pancreatitis in these animals. That's a possibility. Attempting to rest in abnormal positions. You'll sometimes see that. They'll hang their head down. Here's a dachshund with a hunchback, tail's tucked, head's low, abdomen's very tight. This is an animal in pain. I look for an animal who's stiff, any degree of limp, trembling or shaking, as the lady said in the video. Look for that. Limited no movement when they're awake. They just lay around all the time. They don't want to get up. Here's a dog who's laying in an abnormal position. Look, the head's low, the face looks depressed. Okay, this animal's in pain. Oftentimes they'll lay with the painful limb on the ground, with the normal limb up, the painful limb down. So look for that as well. Whining, crying, barking, growling, things such as that. Although some dogs will stop barking. They may be agitated. They're not grooming themselves. They're just dull hair coat, inappropriate urination, defecation. They may defecate and lay in it, or urinate and lay in it. Gentle dogs sometimes become aggressive. They say they may lick the site or the wound. Signs of arthritis and joint pain in dogs. Again, I said that you can't really correlate always radiographs with clinical signs and symptoms of pain. I've seen dogs with severe degenerative joint disease on radiographs who had little to no outward signs of physical pain. Then I've seen dogs who came in limping, just really in a lot of pain, and radiographs show little to no changes in the arthritic state of the joint. So you can't always relate those two. There are good pain medications out there because of the abuse nature of the opiates, and if you ever prescribe opiates to an animal, you have to make sure that the owner has given them to the dog and not taken them themselves. This is a real problem. We have new pain pills or newer pain medications in dogs like tramadol, Galliprant, things like this that we use as well in a lot of these animals. Cats will have a hunchback, head lowered. They'll guard, protect the painful area. They're sometimes lay abnormally. They kind of rest in an abnormal curled up position. Here's a cat that's in obvious discomfort, heads up, eyes are squinted. It's in a hospital situation, obviously, but it's in pain. Sometimes they'll thrash, sometimes they're restless, sometimes they don't move at all, sometimes they just lay there all day and don't move at all. Sometimes they'll defecate on themselves, they'll urinate on themselves, and won't even move. Sometimes they'll hiss, like this cat is, if you grab the painful area. Sometimes they won't vocalize at all. So it just varies from animal to animal. Hyperventilation, look for increased respiratory rate, increased pulse as far as signs of pain. Poor and no grooming. Oftentimes cats in pain stop grooming themselves. Their hair coat looks real greasy. Their rear ends will be dirty. They're not cleaning themselves. Back in the back end, look for that as a sign of pain. This cat's eyes are squinted. His ears are down. His head's up. He's not comfortable. Out of character, aggressive or playful cats may become docile or quiet, and docile, quiet cats may become aggressive. They'll sit in the back of the cage if they're in a hospital situation, hide under a blanket if they're in a home. They'll hide under the bed. You won't see them for several days. They hide out. They don't want to be around people. And sometimes they try to escape. Sometimes they try to get away from the home because they think something in the house is hurting them. Equine pain, acute pain, they don't want to be handled, they're restless, they'll sometimes have a rigid stance, so look at their pupils be dilated, watch their respiratory rate and pulse rate will usually be elevated, sometimes muscle tremors, flared nostrils, things like that. Here's a horse who's sweating. Musculoskeletal pain, they don't want to move, they'll hold their limbs in unusual positions, they'll limp. Head bob is a real good way to help determine which leg the horse is lame on. If the horse is lame in the front end, the head will go up on the lame leg. So the bad leg, when the bad leg hits the ground, the head goes up on that leg. If it's a rear leg lameness, the head will go down on the bad limb or the painful limb. Here's a horse in visceral pain. See the sweating, the horse is sweating, they get this sawhorse type stance. They're trying to get as much stress and pain off the abdomen as they can. Sometimes they get up, get down, excessively abnormal gaits. We can see here quickly just
Hi, I'm Dr. Joanna Robson. I'm the Doctor of Veterinary Medicine and owner of Espiritus Equine Incorporated. Welcome to Recognizing the Horse in Pain and What You Can Do About It. Some of the most common signs of equine pain include bucking, biting when saddled, rearing, trouble with lead changes, having a very hollow or tight sac, snaking of the head, refusals, and lack of engagement or refusal to move forward off the aids. A good place to start is to learn how to palpate with refusal for signs like looking for a dip or there we have a twitch. Here's an example of what we call a kissing defiance lesion. When assessing the horse's back for pain, we must also consider the role of the rider. Proper rider positioning is essential to your horse's back health.
this is why the chiropractor is good to help adjust the rider as well as the horse.
Whereby the horse will hollow out through the back, lift up through the head and the neck, flatten out to croup. Measure the distance between those two lines. We have about a 5-finger range of motion through standing square and extension. The pressure on the pommel of my saddle is if I had a rider in weighted saddle. I'll take the flat of my opposite hand, insert at the top, and slide down. And we're going to look to see from the dust pattern created by that saddle if the saddle was shifting to the left, to the right, or actually twisting. In the sashaying horse, instead of tracking straight, he's actually circumducting, is taking his legs, swinging to the outside. So we want this horse to actually, as much as we can, with adjustment and body work, to track more straight, and then making high velocity, low amplitude thrust. This causes a reflexive relaxation that actually causes the muscles to let go, the soft tissue to let go, for Mother Nature to return that joint to where it should be going. Stimulating those points releases neurotransmitters and endorphins. And from an Eastern medicine standpoint, in addition to those things, we also think again about our chi flow, our energy flow. Then when we add our other things like electricity or vitamin B12 to these points, we increase our stimulation of those acupuncture points, stretching out, relaxing, getting very soft and sleepy both of your thighs. These are all classic signs of the release that we're looking for with our acupuncture treatment.
Alrighty. So abdominal pain in horses, they may look and bite and kick at their abdomen, may strain, may splint the abdomen, which means tense it up. They may get up and lie down frequently. They may sweat. They may roll and thrash. They may walk in circles. They may stand rigid as that horse I showed you previously, and not move and just stand there like in what's called a sawhorse stance. Here's a horse in abdominal pain. He's looking at his abdomen. He's trying to bite at his abdomen. Here's a horse who's rolling. They're on the ground rolling. They're trying to get the stress off their abdomen. They're in pain. Chronic pain, you'll see weight loss. You may see changes in eating and drinking habits, changes in sleeping and recumbency time. They may go off by themselves. They don't want to be around other horses, which is atypical because horses are social animals. You'll see changes in other changes in the animal. Hey, give me. I'm finishing up a recording real quick. Give me about 3. I'll call you right back. Bye. Sorry about that. I thought I put it on pause, and so forgive me for answering my phone while you were listening. All right, so you see these changes here. We're almost through. Pain behavior in farm animals. What you might see in horses. I mean, it's going to be cattle and things. They'll go separate from the flock. They're not interested in their surroundings. They'll have a decreased mentation, decreased appetite. They'll grind their teeth, which is what causes bruxism. They may vocalize. They may stick their head out and strain, tenesmus, straining type of activity. Here's a horse that's in, I mean, a horse. Here's a dairy cow, a Holstein cow that's in pain. You see how thin she is. You see her thinness. Her ribs are showing. She's got this, protruded head. She's straining back here to go to the bathroom. She's grunting. This is a cow in pain. As I said, may grunt. They may have a hunchback. They may not want to stand. Maybe in sternolateral recumbency. Increased heart rate, increased respiratory rate. Here's a cow obviously in pain. She's on her side. She's almost torticollis, pushing her head backwards. She's been thrashing around here. She's in pain. So not normal by any means. The dog's body, I think you should be aware of the different areas of the dog and what they're called, especially, dog breeders and things know where the hock is, where the carpus is, the pastern, the shoulder, the muzzle, the stop of the dog, the withers of the animal, the loin, the croup or the hip area back here. Be sure to know those areas. We will finish this lecture in the classroom. And again, sorry I answered the phone when you were listening a while ago. I thought I put it on pause, but I didn't. But you guys have a great day, and I'll see you soon. Thank you so much.